to Angelic Lift Wellness. This topic is going to ruffle some feathers. We are going to be talking about insurance coverage of hormone replacement therapy. Why the disparity? A lot of times patients come in, they're having symptoms, classic symptoms of hormone depletion, okay? They're in menopause, or in the case of men, in andropause, okay, which means their androgen levels have slowed down. And we test by blood work, by saliva testing, by finger prick, whichever method you choose, and we find that the hormone levels are low. And we go, well, according to this test, yes, your hormones have been depleted. We need to do something because we want to reduce your risk of heart disease. We want to reduce your risk of cognitive dysfunction. We want to reduce your risk of bone fracture. We want to improve your muscle building ability. We want to have you have better sleep. We want to have you have better libido. All these benefits. So then the patient is like, great, let's fix that. And then I go, but not all insurance plans cover hormone replacement therapy. So then the patient is looking at me like, what do you mean? Like, that's gonna get me healthy. Why wouldn't they cover that? And so let's talk about what I've been seeing with the different insurance companies that cover you for your health care. One of the concepts, and this is going to be very important, I can only go into it so much here on YouTube, okay? If you really want to hear the full story, you're going to have to join my free VIP group where we talk about topics that we cannot talk about on YouTube, okay? Let's say I have a male patient coming to me, the office, and we go over the blood work. And we find that, yes, you've been having this symptom of belly fat growing, no motivation, you're not recovering from exercise quickly, your libido is not quite the same, you're noticing that you're not sleeping that good, and I'm going, okay, maybe I'm suspecting, this hormone might be low, let's check it, we find that, yes, you are low, your testosterone level is below where it should be. And we go, okay, here are the options that are available. And we go over all the different forms like we talked about in previous videos, and the patient picks the one that is most appropriate for them, and I agree. And now it's, okay, how do we get that covered? Well, what we're finding is that not all insurances cover all the methods, especially when you choose that you prefer the natural option versus the synthetic. Now, we talked in other videos about what those are, so I won't go into it in this video. But a patient might decide, you know what, I just want something that's identical to what my testis was used to seeing, so that he knows exactly what to do with it and there's no potential, risk in the future. I'd rather just give it the natural one. And the natural one, called the bioidentical testosterone, might not be covered by your insurance because your insurance decides that, okay, that is an experimental option and we don't cover experimental things. But this other testosterone that is synthetic, that is made by this 𝐥𝐤𝐬 pharmaceutical company, we're going to cover that. So now the patient is left to go, but I want the natural option. I'm like, well, but your insurance says they're only going to pay for this one. So now the patient has to make a switch or they end up paying out of pocket. So what we are seeing in the whole hormone replacement therapy arena is that a lot of the synthetic hormones are the ones that are covered. And when you choose that you rather have a natural option, it becomes like, well, that's like a vitamin, so you're going to have to pay for that out of pocket. So it kind of puts a limitation on you, if you will, as far as what options you really have. Because even though you prefer this, you might have to pick this because that's what your insurance is going to cover. Now, we always weigh the risk and benefit, and if I think that your risk with a synthetic option is greater than the benefit that it's going to give you, I'm definitely not going to advise you to pick that option, even if it is the option that is covered. So let's use an example, and I've mentioned this in other videos, about progesterone, for example, right? So progesterone, the natural progesterone that your body makes, we have a natural option for that, and you can find progesterone by extracting it from sweet potatoes. We call them wild yams. We can also find it in soy, right? So there are pharmacies that can make what we call the bioidentical progesterone that you can get, sometimes even some degree of it over the counter. But there's a prescription form of it as well, called Prometrium. And this is an FDA-approved medication. But every now and then I'll have a patient's insurance companies just say, nope, they're not paying for Prometrium. The only thing they're going to pay for is Provera. And I don't know if you guys have heard that one. Provera is the synthetic progesterone made by 𝐦𝐤𝐤𝐬 pharmaceutical company, okay? So if your insurance company says Provera is the only one they're going to cover, now you have to decide that even though Prometrium is what you would like, well, Provera is what's covered. Well, what's the problem with Provera? Well, when we go back and look at the Women's Health Initiative, that was the one they gave the women that were having the blood clots and the heart disease and the breast cancer and the stroke. Maybe I don't want that one. So, but why would they pay for this one? Okay? So this is what we're having to discuss in the consultation room to help my patients understand, like, sometimes the choice that will be most helpful for you and reduce your risk might not be covered. And so when you go down this hormone replacement therapy journey, you are going to have to be prepared that sometimes the option that would be the most optimal for you, the best one for you, might not be covered by your insurance. I hope that makes sense. That's just one example. I mean, I can go on and on. I mean, we see the same thing with estrogen. A lot of times, Premarin is the synthetic, or we call it it's not synthetic. It's extracted from the hormones from horses, right? Their urine. And it has a lot of different estrogens in it, and some of them do work similar to the ones that we have in our body. So Premarin kind of gives you an option, but you might want estradiol, which is the natural estrogen that is bioidentical to the one that your ovary makes. Well, when we start talking about estradiol, we're talking about prescriptions like the Vel-Dot. You might have heard of that patch. And not all insurance companies cover it. And when you have to start paying hundreds and hundreds of dollars out of pocket every month to just get that patch, you might start considering, okay, well, if they're going to cover Premarin, even though I don't know if that's the best one for me, then some patients want to go that route. Okay, so those are the things that we discuss as we get your labs back to determine, okay, which option is going to be the best for you, even if it's not covered by insurance, so you know, for you in your particular case, considering all of your risk factors, considering your family history, considering your personal cancer history or heart disease history, which option should we go with, right? So we have to weigh those risks and benefits. And any doctor that's not doing that with you, you should be asking these questions to make sure that you are picking the one that reduces your risk the most, right, and gives you the maximum benefit. Okay, hope that helps. I'll see you on the next one.